Good morning, everyone. If it was your job to manage this crisis, if you were the prime minister or the mayor or the premier or an MP, would you not try to find the quickest and shortest pathway back to normal, back to open, back to running at overcapacity in the hospitals? Maybe we try and fix that problem while we've got the extra spending money, but instead, that's not happening. It is not my opinion that the leadership are taking this shortest pathway approach. They don't appear to be looking at the data. If I were in charge of this, I would be poring over the data and telling people about the data that I'm poring over and why I believe what I believe. So far, basically, the leadership says the health professionals are telling us that we have to do this. Okay, so I've read a report and I've reported on a report before from Wuhan, China that talked about asymptomatic spread. If asymptomatic spread doesn't happen, like the report from Wuhan, China concludes after studying 10 million people, just under 10 million, 9,800,000. After studying that many people, they came to the conclusion that asymptomatic spread doesn't happen. And I'll show you some other reports that collate other reports from around the world that come to the same conclusion. Here's the University of Florida researchers find no asymptomatic or pre-symptomatic spread. So this isn't just from Wuhan, China. And we can be skeptical. Let's in fact be very, very skeptical about China's numbers. We've had 10 months of this virus circulating in Canada, in Ontario even. Were I in charge, were I the premier, I would say to the mayors of all the cities, get your universities testing the healthy positive cases. The people who are positive that don't have any symptoms. Let's test them and all their contacts, just like this Wuhan study that I'm about to read. And if we come back with the same result, that no people are sick, or in the Florida one, statistically zero. It's 0.07 that asymptomatic spread counts for, right? 0.07. So that's a very, very small amount, statistically zero, okay? So when you get to that point, when you get to that low point, there's no reason to not have things opened up. Yet we're not doing these tests. We're not even considering doing these tests. In fact, all we're doing is utilizing failed previous draconian lockdowns, and we're being told that our culture must be destroyed, our businesses must be destroyed, our economy must be destroyed in order to save some people from a virus that 99.7 people will survive from if you're under 60. And if you're above 60, then your rates are a little bit lower. But realistically, does this make sense? Does the cost balance with what we're trying to do, right? It doesn't make sense to me. Okay, here's the Nature, and all of this is linked in the description. Feel free to have a look. Here's the Nature publication. This is from the Wuhan study. Here's the abstract. Stringent COVID-19 control measures were imposed in Wuhan between January 23rd and April 8th, 2020. Estimates of the prevalence of infection following the release of restrictions could inform post-lockdown pandemic management. Here we describe a citywide SARS-CoV-2 nucleic acid screening program between May 14th and June 1st, 2020 in Wuhan. All city residents aged 6 years old or older were eligible, and 9,899,828, 92% participated. No new symptomatic cases and 300 asymptomatic cases. So nobody was sick, and 300 people tested positive but had no symptoms. Okay, and they give the stats on that. Were identified. There were no positive tests among 1,174 close contacts of asymptomatic cases. 107 of 34,424 previously recovered COVID-19 patients tested positive. Again, repositives tests. The prevalence of SARS-CoV-2 in Wuhan was therefore very low 5 to 8 weeks after the end of the lockdown. Now, the repositive testing could easily be explained by false positives. I wanted to underline this again. In a study of 10,000, and we have to underline this too, don't just believe China. I don't just believe China. But we have a model for a very effective test that could give us an answer in a very short period of time. How many people are asymptomatic? Test their close contacts. All of them. Why has our public health not come up with this very reasonable, very, very easy to do plan? This is simple. And then we can confirm it. Or you can confirm Wuhan's result. Or you can say, no, these people tested positive and then they were sick. Or these people's close contacts from asymptomatic cases were sick. But how are we going to know? unless we do these tests. How come? Why do we not know the number of asymptomatic people, the number of healthy people testing positive every day in the case numbers versus the number of sick people? How come that's not a metric that we're allowed to have? It's something that is very important to know because it might give us an indication into the number of false positives. Okay, so very, very interesting study out of Nature. This is a longer one. Asymptomatic cases may not be infectious. Wuhan's study indicates. This is published on December 1st, but it's citing the same study we just talked about, so I'm not going to go through this very much. This one is report University of Florida researchers have found no asymptomatic or pre-symptomatic spread of COVID. The study was published online by the Journal of the American Medical Association. So here's a newspaper article about that. It's at the Rational Ground, but here's the source. And I've talked about this earlier. Like I talked about this earlier this week, but the Journal of American Medical Association, okay, and household transmission of SARS-CoV-2, a systemic review and meta-analysis. So this is looking at all of the published works and materials, and it's all cited, right? Like you can read the originals all here, right? Talking about attack rates, etc. But the conclusion it comes to, and there's only four studies for asymptomatic, so take that with a grain of salt. But again, we can come to our own conclusions. We've got 10 months of data. Why are we relying on just the models? It's not appropriate. But it says these findings are consistent with other household studies reporting asymptomatic index cases as having a limited role in household transmission. So yeah, the conclusions are not clear, but definitely draw a line to doubting asymptomatic spread. This paper is the most pessimistic estimate, the worst pessimistic, for the rate of transmission from pre-symptomatic cases. It shows they accounted for 6% of transmission, not 1/3. It's not zero, right? But is 6% enough to destroy our economy, to destroy our culture, to put masks on forever? Why, my last question, the obvious tests aren't being done, the obvious scientific analysis isn't being followed up. And if the obvious stuff isn't being followed up, I have to question, why are we only being given a choice of this new mRNA vaccine that didn't have animal trials and is causing negative outcomes? And I'll show you the negative outcomes in just a minute. Bell's palsy is one of them. Why is that our only option when we've got at least two, and I'm going to show you the weaker of the two right now, but there's another medication, the miracle medication, Imverdesan or something like that, that is supposed to deal with COVID very effectively 100%. So isn't that interesting? Anyway, this one is hydroxychloroquine. Only a 1 in 17 billion chance hydroxychloroquine doesn't work, medical professor. And there's a video here, he's talking about it. He says, this is from 29th of November 2020. He says, hydroxychloroquine really works, says Professor of Medicine Dr. Peter McCullough, describing the treatment as the most widely used therapeutic to treat COVID-19 in the world. The chances that it doesn't work are calculated to be 1 in 17 billion, he told Sky News. There's no controversy over whether or not hydroxychloroquine works. The controversy is on the public health approach to COVID-19. Yeah, the lockdowns don't work. So we have medications that doctors are saying work, and they're being silenced when they say they work. And here is a registered nurse. This is being removed from Twitter. It's still on Parler, but the original person's account got removed. I'll just play a little bit of this, but this is very impactful. And why are we doing this to ourselves? Why are we letting our leadership do this to us? Because that's what's happening.
I am a registered nurse in Nashville, Tennessee, and my name is Kalila Mitchell. I'm reaching out to everyone about the COVID-19 vaccination. I recently took the COVID-19 vaccination. After the shot, I felt fine, but within 3 days, I went to the doctor because I had problems with my face. The whole left side of my face, actually. I have Bell palsy now. And as you can see, I can't smile. I'm trying to smile. I'm just kind of embarrassing for me. But I just want everyone to know that.
The quality on this video is not the same quality as the original. The original is a little bit lighter and easier to see. But there are real adverse outcomes that are being recorded by the CDC in the United States. So I don't understand why our leadership is not questioning why a drug that's used for malaria and has been safe for 60 years, hydroxychloroquine, is not being utilized. Why we're skipping these vaccine animal trials, why we're just going directly to having people injected with the vaccine. Is that acceptable? Like, usually a vaccine takes more than a decade to develop, and this vaccine doesn't stop your ability to get it. It doesn't stop your ability to transmit COVID-19. All it does is reduce the symptoms, but the symptoms are such that we've got hundreds of people testing positive and they don't have symptoms at all. So, and if you don't have symptoms, it looks like you're also not contagious. So isn't that interesting? I feel like the false positive aspect of this is just being ignored. This was supposed to be a short video. It's it's the same length as one of my old videos, and that's kind of funny. Anyway, here's face masks don't work, excuse me, from a doctor. Again, we're using interventions that don't work in order to solve a problem that is being exacerbated by the actual face masks themselves. To solve COVID-19, this doesn't work. Here's the doctor saying it.
That I researched bioweapons and all sorts of stuff and masks. And I'm going to tell you, in my entire professional career, I have never heard anybody actually believe that any kind of masks, short of an actual level 4 containment suit, made a difference to small particle viruses. In fact, the CDC itself just published an article in May exactly saying that. You cannot contain influenza with these masks, and that's even larger than this virus. Now, I reviewed all this science. I gave a talk out in Nevada last month, and it's online, YouTube, Medical Technocracy in my name, and you can look at all the sciencey stuff. My conclusion, looking at all redoing my investigation of this time, is that people that are now purporting to scientifically prove masks work are either being paid or being played. This just doesn't work this way.
There you go. I mean, that's not my conclusion, but it is a conclusion. Here's a whole thread looking at the seasonality of the flu, influenza, COVID-2, RS5, and basically making the same case that, I mean, while COVID-19 appears to be a strong flu, it's just no more than a flu. Man, my main question here is, if the leadership was doing the job of getting us back to normal as fast as possible, why aren't they doing the basic experiments that would be required to confirm or deny if asymptomatic spread exists or not? We have the data, we have the people, we have the ability to do the test. Why aren't we doing it? Why aren't we figuring this out? Why aren't we looking at this? It is an absolute shirking of their responsibilities that they haven't done this, and the fact that we're in a further lockdown because they haven't done this. It's been 10 months and there's absolutely no option other than a full lockdown. And you can't, I called the public health yesterday and they're closed for the holidays. Hold on, let's see if I can play it. Hold on. Yeah, here's the call I made on December 28th.
Thank you for calling Public Health. Over the holidays, we will continue to provide key services related to disease control and public health emergencies in Wellington, Dufferin, and Guelph areas. However, our offices are now closed for the holiday from December 25th to January 3rd. Regular hours will resume January 4th.
Isn't that nice? They get a nice little holiday. It's probably paid, right? All those businesses they've destroyed because we're locked down, because they have not done their jobs. And they don't need to do their jobs over the holidays. It's the holidays, right? Take a break, everyone. You're locked down anyway, right? Put your feet up and enjoy it. I'm angry. I'm angry because they're not doing their jobs. It's very clear they're not doing their jobs. Thanks for watching, everybody. There'll be another video shortly. I wanted to be really focused on this, and I thought it was going to be 4 minutes. So, All right. Thanks for watching. Have a wonderful, wonderful day.